Hey y'all, we're going to be going live with Jan Marini here in just a second. Today we're going to be talking about pigmentation. So anybody that has questions about pigmentation and how to treat it, we are going to be happy to answer your questions. So let's get Jan on right now. Here we go. So Jan has always been gracious enough to talk to us about acne and pigmentation. Hey Jan!
Hi, Courtney. It's so good to see you.
So good to see you. You look beautiful as always.
Oh, you're so kind. Thank you.
You do. You look great. So excited to talk about pigmentation and discoloration today.
I know, I'm excited.
So to start off, I want to talk about just first, like, why do you think that there's so many people focused on pigmentation, and why is it so much more of an issue now than it seems to be, at least in previous years?
Well, I think it's probably always been an issue, but we're really focusing on today. People want their skin to look authentic. We want our skin to look good, even if we have a day where we're not wearing foundation. It's a choice. And the fact is that every single person on the face of the earth, if you have skin, you're going to have abnormal pigment by the age of 35. That's a fact. And if you don't have obvious brown spots, you have something called background pigment. So if you look at a picture of somebody, let's say, they're 30, 35, 40, and you look at a picture of them when they're 20, their skin is not as crisp. It doesn't have that same clarity, that same luminosity, that same reflective look. And that's because of background pigment. So those are all things that we can actually address. And in focus groups, they've actually shown people pictures of individuals that have lines and wrinkles and individuals with pigment, and very often they guess the people with pigment as being older than the individuals with lines and wrinkles.
I can definitely see that, and I think that's obviously too why a lot of people want to address it. They don't want to look older, and they know that it ages them. So what are the different kinds of discoloration? I know that there's discoloration after acne, and then melasma. Could you talk a little bit about that?
Well, I'm going to kind of generalize it for a moment, and I'm going to talk about three types of pigment. And there's a reason. There's a reason why I'm going to talk about this. But essentially, there's what we call epidermal pigment in terms of being able to actually address pigment. There's epidermal, there's dermal, and there's mixed. And mixed is a combination of dermal and epidermal. So let's say you look at your skin, and let's say you have two spots of pigment, and they look exactly alike. Under a Wood's lamp, the epidermal pigment will actually show up. The dermal pigment will disappear. And a Wood's lamp is, those lamps that they're sort of like a black light. And so the reason why, and by the way, most pigment is epidermal. Sometimes you get mixed, but most is epidermal. Now, why is it important to know that? Well, the reason is because when we address pigment, we are going after something called active tyrosinase. So active tyrosinase goes into the manufacture of pigment. And you have a couple of different branches. You have a yellow-red branch, you have a brown-black branch, and depending on your ethnicity and hereditary, your heritage and all of that, you're going to either have more red, yellow, or brown back thrown off and tyrosinase goes into the manufacture of pigment, and then keratinocytes take it to the surface. So if you're going to address pigment, you have to focus on active tyrosinase as one of the elements. Active tyrosinase is only found in the epidermis. So if you've got dermal pigment, it's like trying to remove a tattoo. Can you imagine removing a tattoo topically? So that's where lasers come in. And that's why it's so wonderful to have this mixture of the topical aspect, but also aesthetics, where you can have lasers that in a non-ablative fashion can actually assist with that deeper pigment. Now, again, most of the time we're dealing with epidermal pigment.
And so, what are some of the ingredients or products, historically, and then, more recently today, that are used to try to treat these issues?
Well,
topically.
Okay, so I always use the term non-negotiable. And because there are two things that you have to do. And I always say you can do anything you want, you can use any products you want, but if you're actually going to address pigment, you've got to do at least two things. Now, one, you have these old pigment cells that are on the surface. So the keratinocytes have taken the pigment up there, and you've got some old cells on the surface. And you can actually address that pretty rapidly. And that doesn't mean you're going to make it disappear completely, but you can really brighten the skin, and you can significantly improve the luminosity and the even look of the skin, and at the same time, the size of your follicles and the appearance of fine lines and wrinkles and all that. You can resurface the skin. Now, that's done with the skincare management system. And you need to do that in a way in which it's non-inflammatory. You can be aggressive, but non-inflammatory, because when you add inflammation in, you know as well as I do what happens. People pigment. Sun is inflammation. UV light is inflammatory. So you have to be very careful. And these are things that can dramatically change and even help to change and encourage the way the skin functions for future pigmentation. So skincare management, that is critical. And you can see a very rapid difference. Now, the second thing is we need to address all of these aspects that go into how pigment is thrown off to the surface, etc. So I'm going to talk about kind of 4 different segments. And this is a product that is called Luminate Face. Now, Luminate Face, number 1, has tyrosinase inhibitors. So you remember I talked about you have to kind of go after that active tyrosinase in the epidermis. So it has tyrosinase inhibitors. Now, we've got all kinds of tyrosinase inhibitors, all of the ones that you would find typically that would have some type of medical validation. And that would be like kojic acid, potassium glyceride, which is an active chemical in licorice extract, alpha-arbutin, and I could go on and on. So that's one aspect. Now, here's where we get into the game changer. This hasn't been done before. You have a melanocyte stimulating hormone. Okay, so it stimulates pigment. And we all have pretty much the same amount of this hormone. It doesn't matter if you're a redhead with freckles or if you have really dark skin. You may have more if you're pregnant. You may have more if you're on birth control pills. But that plays a role in how you're going to react in terms of your genetics, your ethnicity. Some people sit in a hot car, they pigment. Some people go outside 10 minutes and they pigment. So for the first time, we have a peptide that can downregulate that hormone. So this is really a game changer. And particularly when you get into things like melasma, we can talk more about that when if you kind of want to define sort of the names that we give pigment. Now, the third area is that we have in here turmeric. Now, turmeric has been used for centuries in India. And people would put it on their face, maybe before an event, even for 3 or 4 days. They could get lightening that quickly. But the problem is the whole time that they're getting the light, they're using it, their skin is bright yellow. And so they've tried to do things like take pieces of the root or parts of it and formulate it to see if they could get that effect. For the first time, we've been able to take the active chemical and make it colorless. And it's also anti-inflammatory. It's anti-aging. Even helps a little bit with acne. Okay, finally, we have a retinoid in there, retinol. Now, retinol is also a game changer. And I think people don't really give retinol enough credit. And I'm talking about if it's in the right formulation, the right percentage. Because there's over 40 years of research. It's conclusive. There's no dispute. And retinoids get pigment out of the surface faster, but they can change the way that your skin functions. Now, and excuse me for this long answer. But,
no, I love it.
Okay, so most of the damage you're going to see in your lifetime happened before the age of 10, at least 50% before the age of 20. So even though you have genetics that play a role in all of that, sun exposure is a primary underlying factor. And so the UV light, what it does is it programs this damage into your DNA. And your genes are made up of DNA. Some of your genes are expressive genes, and we refer them as expressive genes because they send out messages, but it's the only messages your body listens to. It doesn't, if you break a bone, if you have a sunburn, if you have an illness, and those messages get compromised more as time goes on because you have more and more exposure, you age, until finally you just don't repair anymore. And then, you move on. So retinoids have actually been shown to be able to change gene expression. They can profoundly change, and they really can have an effect on pigment and all of that. And then at the same time you're using them, I mean, we know that they're dramatically effective for all of the various signs of aging. So that again is what the term that I use is that there's no substitutions, it's non-negotiable, and it's the system and it is the luminate. Those two things.
So the Luminate has all of those in it? I know it has the retinol.
Yes, it has all of that. Now, the other thing I want to mention, and excuse me because I forgot, the luminate, that study has actually been written up in the Journal of Drugs and Dermatology. And it went half-face comparison head-to-head with prescription hydroquinone. And we won.
Wow.
So this really is a game-changing technology. And you can use it indefinitely. And the more you use it, the better your skin looks, because again, it has these other components in it that can make a difference in how your skin looks from an aging perspective.
I love the Luminate. Absolutely. Do you recommend people use it morning and night or just at night?
Well, what we usually recommend is once you acclimate to the system, then you begin the luminate. And you can, most people could start every night, but I always say start off every other night because there's some people that maybe need a little bit of acclimation. And when I say acclimation, maybe if you did it every night, some people might get a little bit red or they might have slight bit of flaking. But so I don't know who they're going to be. So we say start off every other night. And then after a week, you can do it every night. And typically it's once a day. However, you can, when you acclimate, you can use it twice a day.
Okay, good to know. Yeah, because I've been wanting to know if I can start adding it in the morning, but I'm always a little bit weary of messing things up when they're not broken. But we had someone ask a question about pigmentation for darker skin. Is there anything that you adjust or change for darker skin patients?
No. Now, I'm going to kind of preface that by saying that as you move along and you acclimate to the system, you're using your luminant, you're seeing some real results. There are other things you can do to accelerate the process. There's not a cure for pigment. It's not like you get to a certain point and then you just stop. It's something you have to do persistently over time. And it can get better and better. For example, you can do peels that are made for that purpose and other things that would at home, like, for example, we make a peel pad that's 4 different acids and it's instant gratification. And all of that helps to speed up that process. There's other things that you can do, but we're not working with phenolic compounds. So here's what happens with a phenolic compound. Hydroquinone is a phenolic compound. And it's used a lot in the US, and that's fine. I don't have anything against prescription hydroquinone, but it's banned in a lot of parts of the world. You can't get it. And a phenolic compound is paradoxical. So what it can do is it can actually lighten, and sometimes it can also cause hypopigmentation, white spots that are permanent. But at the same time, if it's used for long periods of time, and it's not intended to be used indefinitely, it can cause blue-black pigment. And blue-black pigment is just exactly what it sounds like, and it's permanent.
Mm-hmm.
So this is something that we don't have to worry about in terms of various skin types. And the reason I talk about using it with the system is, let's say that somebody is decides they're going to use Luminate. And then they say, yeah, and I also want to make my skin look brighter faster, and they use a scrub. Well, scrubs, even with you have really fine granules, can create microscopic tears in the skin. They create inflammation, may make the pigment worse. So this is designed to be able to achieve some really extraordinary results and not have those kinds of issues.
Right. Yeah, no, that's a very good point because I know a lot of people will start, many things at one time, and then it's really, I mean, it's hard for me not to do it too because I'm using something and I don't give it the, right amount of time before I want to start something else, but then it never ends well because you don't know what's not working and working. And if you have a reaction, it's a mess. And so we talked about it a little bit, but what are some of the primary differences in the different types, or primary differences in what causes discoloration?
Well, okay, so the term that we use most commonly is melasma.
Mm-hmm.
Now, technically, melasma means mask of pregnancy. So I always kind of chuckle in my head when somebody says I have melasma, and I always want to say, "Oh, are you pregnant?" Now, that's okay. We can call it melasma. We don't have to get really technical. But melasma is sort of a diffuse type of pigmentation, as opposed to, let's say, you have a big brown spot or a solar lentiginous, and it typically can happen in this area and on the upper lip. And if you're not pregnant and you have the exact same thing, it's pretty much the same because it's kind of hormonal. It's called chlasma. And again, women of childbearing age oftentimes are prone to these various kinds of hormonal issues, whether you're pregnant or not, even men. And so it's designed to be able to help address all of that, the appearance of all of that. And then there's things like age spots, we call them age spots, solar lentiginous, people that get freckles, people that just get uneven pigmentation strictly from the sun. But here's the bottom line. Regardless of what the cause is, the most exacerbating factor, the underlying factor, is always sun exposure. And the system has a sunscreen in it, but I tell people, you have got to wear sunscreen. I don't care if you're going to open the door, reach out, and pick up the newspaper. You have to have your sunscreen on. You need to wear it indoors. Now, there have been studies through the years, but there was another one by Dr. Ronald Moy, who is a very famous derm from UCLA. And what they've determined is if you're sitting in your house and you have your drapes or your blinds open, that you're getting in UV light. In fact, if you've got these really big, kind of open windows, during the week, it's kind of like being on the beach for a weekend. You're going to exacerbate your pigment.
Yeah, I think there's been a photo that's gone around viral 100 different times with a set of twins that I believe they're like in their 50s, 60s, and one of them sat by a window, her whole life at her job, and one side of her face is, extremely sun damaged, and she didn't have that much more sun exposure than her twin, who doesn't have any sun damage, and obviously the only difference was where she was working inside by a window. So, I mean, I'm like, if anyone was told not to wear sunscreen inside, I think that's a prime example of how you should.
That is a fabulous example. And I have to tell you, I used to have a picture that I would show at medical conferences or places where I would do different, discussions. And so I put up the first slide, and it was the side of a man's face. And there was a few, aging, signs of aging, but it looked really good. And then I put up the second side, and it was just a mass. I mean, it was a roadmap of wrinkles. He was a truck driver.
I think I've seen that one. I know. It's a great example.
Yeah.
And I mean, that's one of the ones where you are like, okay, if you don't wear sunscreen after that, then you're not going to wear it. So, I mean.
Well, when you speak of twins, they've also done studies where they've taken twin girls, and they both use kind of the same skincare, but one uses a retinoid. 10 years later, one will look 10 years younger than the other.
Wow. I'd love to see that one for sure. Because I mean, even over the years, the patients that come in just have the most beautiful skin and, look literally 20 years younger than they are. I say, what have you done? And it's always, I started using Retin-A young. I started wearing sunscreen young. You know, they didn't have these
Mm-hmm.
big treatments or anything. So that's great. And then what about discoloration from acne?
So
Can we talk a little about that?
yeah, that's a little different. Okay. So first, let me say that a lot of times people will say, well, I have acne scars. And what they really have is discoloration. So a scar is actually an injury to the dermis, and you have like a depression or you have something that's compromised. But what usually happens, depending on your skin coloration, is you have what's called post-inflammatory hyperpigmentation. If you're really fair skinned, it might be red. If you have more pigment in your skin, it can be like more purplish, brownish, even blackish. And so that's a different kind of pigmentation, because what happens is acne is an inflammatory disorder. As the inflammation makes its way to the surface on your way to getting a breakout, it kind of disturbs some of the blood vessels. And blood is made up of various colorants, bilirubin, ferritin, so it kind of leaks out, and that's what you end up with in that inflammatory process, as having that discoloration. Now, you can get it out of the skin, and it's not going to be with luminate. You know, you could have background pigment, and certainly using luminate is going to brighten everything up. But what you have to do with that is you've got to prevent the acne. There's no cure for acne, but you can get complete, total clearing. And we use a system and a product called Duality. And not only does Duality provide clearing, but also it has an ingredient in there that gets rid of discoloration about 300 times faster.
That's really great. I mean, Luminate and Duality are by far my two favorite products I use out of anything, because they're easy to use. They don't cause a reaction on me. And, you know, I'm pretty sensitive to a lot of things. And even the retinols, the benzol, nothing causes sensitivity at all. So I absolutely love it. And so obviously prevention for any type of pigmentation is usually with sunscreen, like we were talking about. How exactly does sunscreen prevent pigmentation?
So it's not going to prevent it from the standpoint of it doesn't change your hormones. But what it does is it prevents you from absorbing radiation into your DNA. So radiation translates into inflammation. And you know, when you talk about sun exposure, you have UVB, and that's more superficial. So if you were unprotected, that's where you see a sunburn. And then there's UVA, and UVA just literally absorbs. You can get all kinds of UVA exposure and you don't see a sunburn, but it's absorbing into your DNA. And what happens is that's probably far worse overall in terms of how it sets up all of the factors for all that damage that you're going to see. So sunscreen is something that is just absolutely critical, because what it does is it helps to prevent that. Now, with that said, you can wear the best sunscreen in the world, and it's not about SPF factor, it's about how much it covers the entire spectrum. You're still going to absorb about 3% of the rays into your DNA. It doesn't sound like much, but it's a lot. So what you want to do is you want to mitigate that in some way. And there can be other elements in the sunscreen that can assist in adding to some protective element. And that we've got 3 different sunscreens that people can choose from. It's really a matter of preference. But they all have things in them that can help to mitigate that and give the skin a better way of defending itself.
Yeah, no, that's great. And I obviously love the sunscreens. I really like the new one. I think it's filled a void with just zinc that a lot of people are asking for. So I think it's really great. Someone's asking how long you would recommend using the Luminate to clear up the chlasma.
Okay, there's no cure. So this is not something where you use it for a period of time, my skin looks better, and you stop, because your hormones aren't going to stop. All of the factors, all of the things that you're exposed to aren't going to stop. So this is something that you have to do literally indefinitely. And the good news is that, let's just say somebody who doesn't really understand background pigment and they don't think that they really have a pigment issue was using Luminate, their skin is going to look younger. It's going to look better. It's going to function better. So using it indefinitely is a really good thing because you've got a retinoid in there and your skin is going to improve and it's going to look better and better. It's like you said, Courtney, you say you have people come in and their skin looks so great. What have you been doing? Been using a retinoid for years and years.
Yeah, no, absolutely. And I mean, I was one of the ones that fell into, I don't know if I really have a pigmentation problem, but I realized I do. And especially after I used it, I mean, I don't have the full melasma that some people have or a lot of pigmentation, but just the overall brightness and glowing of the skin is just dramatic. And I don't think there's anybody that doesn't want bright, glowing skin. That's the point. So how does redness factor into discoloration?
Oh, that's a great question. Because a lot of times when people are talking, particularly if they're talking about their chest, they'll say, well, how do I get rid of my discoloration? And a lot of that is vascular. If you look at your chest as it ages, there's two components. Usually there's brown spots and there's redness. So two completely different issues. Now, if it's on the face, and I'm going to kind of back up for a second because it's on the face, that's possibly rosacea. So that's a different issue. Rosacea is a disease of vasomotor instability. Blood vessels are designed to expand and contract, expand and contract. In rosacea, the blood vessels are compromised. And it's not a disease of sensitivity, it's a disease of reactivity. It has to do with triggers. It could be food and other triggers that trigger the response. Now we have something for that. So you do the system and you do Rosalieve. And it can make a huge difference in all of those, the appearance of all those characteristics that we don't like with rosacea. Now, on the chest though, it's usually that it's not that you necessarily have rosacea on the chest, although people can flush and blush down into their chest area. It's that because of that constant sun exposure since you were a child, you have compromised those blood vessels. So there are devices you can use. You can use Luminate on your chest. We also make a product called Juvenec, which you can put down into the chest area, which kind of helps with that. But you can use Luminate on your chest area. But to really go after that vascular issue, you need to do some type of device, such as IPL, like intense pulse light. And the good news about IPL is it's not ablative. So it's not like, okay, oh my God, I'm going to have to take a week to recover. You might be a little pink, but there's no downtime. And it's really not a true laser. It's a light that goes after either red or brown in the skin. It can be calibrated to do both at the same time or go after one or the other. And it's a really reasonable service. And typically most people, depending on the extent, you do it about 3 to 5 times, and it can make a huge difference in just blending everything, making it look nice and creamy.
Oh yeah, absolutely. I think it's definitely becoming more of a affordable treatment that most all places have. It's more of a commodity these days, so it's easy to get one done. Speaking of the neck, someone is asking if they can use duality on their neck and chest as well.
Okay, so I'm assuming that they think that they're breaking out on the neck and the chest.
Well, they said neck, yes.
Okay, and do we know if it's male or female?
I think it's a female.
Okay. The reason I ask is because men sometimes get folliculitis on the neck, and that's an inflammation and an infection of the hair follicle. It's a little different. So, but if she's breaking out on the neck, yes, you can. But necks are more sensitive than the face. So your face, you produce oil, and the oil gland or the follicles that are producing this oil, they're aligned with dead cells that are constantly being pushed to the surface. So your skin turns over very quickly. That's why you can do aggressive procedures on the face and you don't scar typically. But on the neck, it doesn't reepithelialize the same way. So it tends to sometimes be more reactive. So you have to do it more slowly. You might have to do it maybe only, you may never be able to do it every night. You may only do every other night. It depends on the individual, but yes, you can treat the neck area.
Is that a good area where you'd recommend using like the benzoyl wash, or is that still
Um,
going to be sensitive?
for adult females, I always recommend what is in the system, which is the bioglycolic facial cleanser.
Mm-hmm.
And the reason is, you can use the best cleanser in the world. It can't get into your follicle. I don't care if it's micellar water. I don't care if it's an oil-based cleanser, what it is. It can't get into the follicle. But the glycolic acid does. It has the smallest molecular weight of any alpha hydroxy acid. And what it does when it gets into there is that it dissolves and dislodges the glue-like substance or cellular cement between cells. That's the beginning of the acne process.
Wow.
So that in and of itself is really helpful in that whole process.
Wow. Yeah. No, that's great. Yeah, I know that a lot of I've seen even my sister suffers from like breakouts on her necks and stuff, and she has the hardest time treating it. So someone else did have one more question where they ask, at what age did you become interested in skincare?
Oh my goodness. Well, I think I've always had sort of an interest in all things medical, but I've been a product researcher for well over 40 years. And I was really interested in skincare. I don't know why. But what I will tell you is that I had three brothers, and my three brothers all had acne to one degree or another. Now, I was in the 2 percentile. In my teen years, I did not have one acne breakout ever. That's only about 2% of teenagers. When I was 19, probably just before I turned 20, I developed severe cystic acne. I'm a 2-time Accutane failure. Now, would I have had such an interest in skincare anyway? Probably. But I always say I develop these things for myself because I'm really selfish. And I'm completely, totally clear. I'm not wearing foundation. So those things are achievable. And anyway, that's kind of a long answer to
No,
how old I
that's
was.
great. I'd love to hear it.
But it's been over 40. I'm going to be 69 in December. And I'm going to say, actually, it would really be about 49 years that I've been doing this.
Wow. Well, it shows. Obviously, your skin is flawless. I think at any age, any of us would love to have your skin. Someone else is asking what lipstick you're wearing.
Oh, my God. Thank you so much. That's so kind. Okay. It's 3 different colors. It's raspberry pink, Bobbi Brown. It is, I can find out really quick.
Okay, good. You show us.
And I think it's, yeah, let's see, just a minute. I've got this huge lipstick bag that I carry with me. You never know when you're going to have a lipstick emergency. Okay, another Bobbi Brown color that's called Rebel Rose. And then the final one is also Bobbi Brown. And I don't wear Bobbi Brown all the time. It just happens to be. But I think this might have been discontinued. It's called Berry Punch. So one is that just you put the 3 together, and that's, I never wear. One of these people, I never put on just one lipstick. I always have to mix them to come up with the exact shade that I'm looking for.
Oh, well, thank you for sharing that.
This is the size of my lipstick. This is all lipstick.
Oh my goodness, that is too funny. Well, those will probably sell out now. And someone else just asked too, what are some good resources for people that are just interested in learning more about the skin in general?
I get asked that question every so often.
Me too.
And it's a hard one to answer because I have to tell you, I peruse probably 30 medical journals a month. And they're not just dermatology, and they're not just, plastic surgery or something like that. It's because I'm always looking for studying and researching technologies, and some of these technologies come out of cancer research, some of them come out of research on diabetes or all kinds of different issues. And a lot of the information that's out there is just so incorrect that it's hard to really send people in the right direction for resources. I don't know. Courtney, do you have things that you refer people to?
It's so hard. We do some virtual training weeks and things like that, where you're able to
Mm-hmm.
get more, information from the brands and stuff. But really, I feel like it's, one of those just research type things. Aside from like going to school and things like that, I don't know of any like direct place. I never know
You
what to
know,
say.
I have one of the reasons that I made a choice way back. This is actually my fourth business, but I made a choice that we were going to dispense into the professional market, is because I really wanted these products to be accompanied with individuals that had some knowledge, and also we do lots and lots of training so that individuals could, via their provider, really understand and get credible information. The average woman has over $600 in product in her bathroom that she doesn't use.
Wow.
And when it comes to these kinds of disorders, give you an example, acne. Do you know that we spend in the US more money on non-prescription acne products, trying to find something that's not going to dry our skin, not going to make us look older, it's going to get rid of our acne, than we spend on all of the prescription acne products put together. So that's why I'm talking to Courtney, because Harbin House is one of these providers that really can educate and provide individuals with true solutions.
Well, thank you. Um, and so last question, someone was just asking about the vitamin C. I also get this one a lot. So, sometimes when you get to the end of the vitamin C, the consistency starts to change, especially with some forms over the other. When it starts to turn and when the consistency starts to change, do you toss it or keep it?
Okay, so that's a great question. So first of all, if you're talking about ascorbic acid, and we're not ascorbic acid is not stable. And you can ask an independent chemist or talk to a university. When it is exposed to water and it's exposed to oxygen and a lot of things in your bathroom, it begins to change color. And in that particular case, what it's doing is you're losing you're losing a lot of the efficacy of the vitamin C. Okay, so that's one issue. Now, siesta is not ascorbic acid. It's L-ascorbic acid 6-palmitate or ascorbopalmitate. It's a lipid-soluble form. And we could go into a lot of talk about how it's more potent and on and on and on. But what I can tell you, it's absolutely, completely stable. It's got a minimum 2-year shelf life. But what happens is we have something in there called DMAE, dimethylaminoethanol, that is for muscle shortening at the neuromuscular junction, helps the skin pull up, and highly, highly anti-inflammatory. And when it comes in contact with that over time, there's a slight browning that takes place, but it doesn't mean that you're losing the efficacy of the vitamin C. So unless you're letting, the product sit in your bathroom for 2.5 years, and I can tell you that when we manufacture Siesta, it comes in the door and it literally goes out the door. That whole batch is out the door within a month. So it's not sitting around here. So you typically are going to have a 2-year shelf life.
Okay, perfect. Yes, she did say she was talking about the one in your line. So unless it's expired or really old, then
Right.
it's just the browning. So you wouldn't have to toss it out.
Yeah.
So that's.
And sometimes what happens too is that this Siesta is one of the most difficult formulations that we have. I mean, it is hideously difficult, but it's so efficacious. But sometimes what happens as you have the product for a while, and you're opening and closing, or you're pumping, you can have a little bit of evaporation of water, and so that could make it slightly more viscous, something like that.
Yeah, absolutely. I think a lot of products at the very end, they start to be a little bit different, especially over pumping and
Mm-hmm.
pumping and stuff. So I use everything. If I don't want to use it on my face, I'll put it somewhere. So I don't let it go to waste. So thank you so much, Jan. We so appreciate all of these that you do. And we are excited to learn more from you later. I know we're going to schedule another one. So that's great. And thank you so much for joining us today.
It's such a pleasure. I always love talking with you, Courtney, and thank you everybody for your audience, and I really appreciate it. And I know I wouldn't be here if it weren't for you guys. Thank you so much.
Same for you. Thank you so much, Jan. Bye-bye.